Kanokpich Satayaprakorb from Physical Therapy, Senior Virood University.
Yes, I'm ready.
Okay, you ready? And your topic is the reliabilities of stroke balance evaluation systems test, S-BESTest in people with chronic stroke.
Yes.
Right?
Okay.
Okay. So you can start.
Okay. Good morning, everyone. I'm Kanokpich Satayaprakorb. I'm pleased to be here today to talk to you about in topic reliability of the stroke balance evaluation system test in people with chronic stroke. The rationale of this study is following: balance essential performing movement activity safely and independently. In stroke patients, they usually will have balance problem. It's known that the functional balance problem can be affect multiple systems. Balance is important to saving when activity. So identification of balance problem and their underlying impact system may help guide specific training for stroke surveyor. A more recent tool, the balance evaluation system test or BESTest is a clinical balance test that approaches 6 domains to characterize the underlying cause for impaired balance control, including biomechanical constraints, sensory orientation, stability limit and verticality, anticipatory postural adjustment, postural response, stability in gait and cognitive involvement in gait. The best test is a good measurement to evaluate balance in stroke patients. But the best test is using a long time to complete the test that limit using in clinical setting. So, newly short version of the best test has been developed. The stroke balance evaluation system test or S-BESTest is a newly short version has been developed to be used in patients with stroke and decrease time to administration. This The S-BESTest can evaluate all systems of postural control while standing and walking in real situations, such as walking with dual task, changing gait speed, and walk with head turn. This item corresponds to the stability in gait problem in chronic stroke patients. A previous study showed that the S-BESTest was excellent reliability and validity of patients with subacute stroke. From above review, the S-BESTest would be the potential critical tool of comprehensive balance assessment. The reliability is important to determine the consistency of the measurement, including inter-rater reliability is a consistency of the test result when being measured within the same examiner across time. And inter-rater reliability is a consistency of the test result when being measured by different examiners. But the S-BESTest has not been studied the reliability in people with chronic stroke. Therefore, aim of this study is to examine the inter-rater and inter-rater reliability of the S-BESTest in people with chronic stroke. The S-BESTest is a material of this study. S-BESTest is a performance-based assessment tool that consists of 13 tasks within the 6 components of the postural control system. This study is using the S-BESTest in English version, and each task has its criteria to determine patient performance, which rank from 0 to 3. The total score of the S-BESTest is 39 point, and it requires 7 to 10 minutes for administration. This study was recruited 10 people with first unit lateral hemophilic stroke onset more than 6 months and age 18 years old and older, able to perform walking independent and able to perform serial free subtraction from 90 at least 5 steps, or able to perform verbal fluency of foot category at least 5 foot. The participants were excluded if they had aphasia, recurrent stroke, any neurological disorder other than stroke, other disease or condition that affect participant safety during a section of data collection, or pain that affect the ability to stand and walk on the day of testing section. The study protocol was approved by the Institutional Review Board of the Faculty of Physical Therapy, Sri Nakarin University in Thailand. The protocol of this study is composed of two main steps. First, letter training was to perform and ensure the Thai letter understood the S-BEST test with the same context. Uh, Three letters with stroke rehabilitation experience at least 2 years were involved in the data collection of this study. They were asked to study a document of assessment method and scoring criteria of the S-BEST test, and they were asked to practice scoring patient performance record on video clip, and then score from the letter was discussed with two physical therapy lecturers who have experience of using this assessment tool. The second step, reliability testing. The letter were asked to watch and score the performance on the video clip within the same limit time. The letter were not discussion of the score or patient performance, or letter score each patient performance from the same set of video clip on the two separate occasions. The second occasion was performed 10 days after the first occasion to prevent recall bias. Data analysis. The demographic and clinical characteristics were collect data that as showing. Interletter reliability was using ICC model 3.1 and interletter reliability was using ICC model 2.1. The result of this study. In table 1 show the demographic and data characteristics of 10 people with chronic stroke. They were aged between 53 to 22 years old and has a wide range of the time post-stroke, and also data you can see on the slide. Next, the result of the reliability testing. The total score of the S-BEST test is shown of the study represented in graph. The graph consists of the X and Y axis are the total score of the first and second occasion respectively. The interletter reliability of each letter show ICC above 0.8. And interletter reliability between three letters show ICC above 0.8. So, the total score of the S-BEST test in people with chronic stroke was excellent interletter and interletter reliability. And interletter reliability of 6 domain score of the S-BEST test of each letter show ICC more than 0.8. It means that excellent for all domains. That's why the interletter reliability of 6 domain score of S-BEST test between 3 letters show ICC more than 0.8. It means that excellent for all domains. In discussion, this study examined the reliability of the S-BEST test in people with chronic stroke. The finding of excellent interletter and interletter reliability of the S-BEST test are as expected, that correspond to a previous study. Therefore, the S-BEST test could provide reliable test results in any recovery state of patient with hemophilic stroke. Moreover, the ICC of interletter reliability of the domain score of the S-BEST test of this finding is higher than a previous study because in the letter training process, the letter has two discussions at before and after the practice of scoring the patient performance about how to each item of the S-BEST test, that the letter understood the scoring criteria better than practice in healthy person. When considered the process of video clip scoring patient performance, we found the factor influence reliability of the S-BEST test. First factor, the criteria when to start and stop video need to be clear, especially the performance that based on time to complete the activity. The second factor, some activity need to record more than one point view. For example, when later need to prescribe performance accurately. The benefit of this study, including the later training, can help improve the later reliability. And the method of later training where clinicians can apply to the clinical setting is also suggested in this study. However, this study represents only the reliability of the S-BEST test in chronic stroke patients. Thus, the validity of the S-BEST test in people with chronic stroke should be evaluated in a future study. In conclusion, this study is clear instruction on how to score the training section with an experienced physical therapist before using the scale are necessary for achieving excellent later reliability of the S-BEST test. That being the presentation to the end. Thank you. Welcome to any question and suggestion.
Okay, it's time to questions for Ms. Kanokpich. And any questions from Chairman อาจารย์เฟื่องฟ้าค่ะ
Okay, I have two questions for you. The first one, do you limit the time to watch video for the assessor or not?
Limit assessor for not no limit but have factor influence because it ICC score in lower border of 95% of some domain have below other domain.
I mean, one assessor can be replay about the video. How much that they can, or you limit them just only time something.
Yes, the later will be one continue video clip with cannot stop and do not replay.
So how do you control about this one?
The control this control by control the time to complete the test within less than 1 minute of the one item.
Okay, and can you tell me about what the implication of your results to imply to the physiotherapy or physiotherapist clinician team?
Because when can apply to the clinical setting before using the all assessment, if the physical therapy has not been experienced using the assessment, you can practice the reliability and interlater using the protocol of this study.
Yeah, but this one is the English version, right?
First, and now only the English version of the S-BEST test, but you can practice with physical therapy who has experience of using the S-BEST test before. But the test of the S-BEST test is the assessment method of the S-BEST test same as the original BEST test. The original BEST test have a Thai version.
Okay.
Can you yes, can you apply the best test original version in Thai version, same as the S-best test?
And what the difference of yours and the original version?
Uh, the S-best test same as the original best test, but have only 13 tag of the best test original. Yes, same context, same method, same same command to patient and patient setting.
Okay, thank you. And why you choose the English version for your research?
Uh, uh, because I because when uh, uh, the later training in English version, uh, but but uh, but the test using in training section using English and Thai in Thai the best test with the physical therapy lecturer to discussion.
And could you suggest, if I'm from Mahidol University, right? And nobody used this best test before. And what do you suggest me how to start with it?
We start you you will be uh, you will be the Sinaclean Willow University is have the เขาเรียกจดลิขสิทธิ์อะค่ะของ The Best Test Original ภาษาไทยไว้อะค่ะ Yes you can send the letter to แบบขอใช้อะค่ะอาจารย์
I have to ask the permission from Sinakarin Virod University, and then yeah, I need to learn from the specialist from there as well, and then I can use in my clinic or something. You think this one can be generalized to another physiotherapist or not?
Yes because in the test is yes you can using in general physical therapist because the best test is the previous study is using many people yes ONE or the spondylosis yes and in multiple sclerosis yes.
Okay, thank you.
Yes, thank you.
Thank you, presenters. Okay, I think shall we move to another presenters? So thank you, Atan Songfa, for questions, and thank you, presenters. So the next